Hello, I'm Margaret Rees. I'm going to talk to you about consent in the context of health and biomedicine. I'm a medical doctor by training. I chaired a National Health Service REC, and I am now on the Open University REC. I have an interest in publication ethics because I'm currently the editor-in-chief of case reports in women's health. My talk will be in 3 sections. The first will be the evolution of the concept of consent in health and biomedicine. The second will be the logistics of taking consent. And the third will be assessing the consent process. Doctors have been undertaking research in human beings for over a century. However, consent only came to the fore after the Nuremberg doctors' trial of 1946. Doctors in concentration camps in Nazi Germany were undertaking experiments in human beings without consent. Some of these experiments, indeed probably the majority, had fatal consequences. At the same time, in the Americas were 2 other studies with consent, without consent. The first one was in Tuskegee, which was a study of untreated syphilis. This started in 1932. No consent was obtained from participants. It was not stopped when penicillin became available and known to be effective for syphilis, and it carried on until 1972. President Clinton apologized in 1997. Between 1946 and 1948, there was a sexually transmitted disease inoculation study in Guatemala. Again, the US apologized to Guatemala about the conduct of this study, which was undertaken without consent. The Nuremberg doctors' trial led to the foundation of the World Medical Association, and it produced in 1964 the first version of the Declaration of Helsinki, which is a code of ethics for studies in human beings. Its last update was in 2013. The first RECs in the UK were in the late 60s and early 70s and were mainly based in hospitals and worked independently until the Central Office for Research Ethics Committees was established in 2000, and in 2011 this became the Health Research Authority. This doesn't mean that research was done unethically. I was looking at research papers undertaken by Sir Richard Doll looking at smoking and lung cancer. And these papers are freely available. One was an interview study of patients in hospitals, and the other one was a survey of doctors. And consent was implied because the people agreed to be interviewed or to complete the survey. Reading these papers is a very clear description of what they did, which would be acceptable by today's standards. There was a further scandal in the late 90s, which led to the Human Tissue Act in 2004. A pathologist at the Children's Hospital in Alderhay in Liverpool was retaining tissues and whole organs from necropsies of children without consent from the parents. And this was in contradiction to the existing legislation. and the Human Tissue Act tightened up things so that consent for taking and retention of tissue is closely regulated. And then 2 years ago was GDPR. If you're submitting a paper for publication and it involves research in human beings, it is an absolute requirement to document that consent was obtained. And this is an example from the Guide for Authors. Authors should include a statement in the manuscript that informed consent was obtained for experimentation with human subjects. And then it further has details if the author wishes to include case details or other personal information or images. The Declaration of Helsinki has got over 30 paragraphs, of which I think paragraph 26 is the most important. I presented the full paragraph, but the items I want you to look at are those that I've highlighted in red. That medical research requires giving informed consent. Consensual subjects can refuse to participate in the study or to withdraw consent. Consent should preferably be in writing, but if it cannot be expressed in writing, non-written consent must be formally documented and witnessed. All subjects should be given the option of being informed about the general outcome and results of the study. GDPR really relates to the Declaration of Helsinki in that it states the person has consented to use of their data. Consent is obtained in a way that is understandable and accessible to the subject, and that there is an opportunity for the person to withdraw. The right to be forgotten, that again concurs with withdrawal and withdrawal of data or tissue samples, but not necessarily if data are lawfully obtained and was still necessary for the purpose for which it was obtained. Because if data were removed, it could mean that a study then becomes underpowered and therefore less relevant. And this pertains highly to clinical trials. So who gives consent? It should be the patient or participant. It could be a legal representative. You have to consider mental and physical capacity. What about the legal age of consent? A child is defined as a person aged under 18, but the age of consent varies worldwide between 12 and 18. So for research in children, there can be consent from the legal representative, who would be the parent or legal guardian, plus assent from the child agreeing to take part in the research. There needs to be provision for emergency research, such as the adrenaline cardiac arrest trial as a prime example, where by its nature, patients cannot give consent. So how could one obtain and record consent? The classic idea is that it should be written, and a copy is given to the patient. A copy is retained by the researcher, and a copy is kept in hospital records if this is a clinical trial. However, some people might not be able to provide written consent because of physical problems, say paraplegia, and here verbal consent, which has been witnessed by somebody independent from the study, would be acceptable. Then one can think of electronic versions such as audio recordings or filling in a consent form on an app on a phone and then having an email sent to participants. Taking consent needs to take into account cultural sensitivities, because in some cultures, signing your name is actually signing away your life. It's important that records of consent are kept, and probably now for decades. In past years, studies used to have a limited time span and data access, but now we have a long-term perspective with future use of data by others, so that's data sharing and open access publication. And misconduct investigations may be many decades later. Currently, there are investigations of studies undertaken in the 1970s. So how can somebody withdraw consent? It needs to be documented in the participant information sheet and the consent forms up to what point, usually a time point, and how and who to contact. If people withdraw consent, the issue then pertains about what happens to previously collected data and tissue. Can this be withdrawn? There needs to be the ability to collect follow-up healthcare data. This is for safety, and this pertains to clinical trials. The Clinical Trial European Directive states that withdrawal of informed consent shall not affect any activities already carried out and the use of data obtained on the basis of the informed consent before that withdrawal, because the information collected up to that point is extremely important to be included in the analysis. I have an interest in case reports. Now, case reports are de-identified descriptions of an interesting medical condition, and the material is potentially identifiable even though the reports don't have people's names, date of birth, dates of treatments, locations of treatment. And people who consent for their case reports to be published need to be aware of this. And once published, dissemination of case reports, including images, cannot be prevented, even if the article has been retracted or removed, because it has been out there and accessible at one time. What about consent documentation? A REC needs to assess the following: the recruitment material and advertisements, posters, emails, Twitter, whatever is used to advertise the research. If you are screening people to make sure that they are eligible to take part in the research, there should be the interview and screening schedules. Then there's participant information sheets, consent forms, and information and assent material for children, and these need to be age appropriate. The Health Research Authority has got a good set of examples. And if a research project has many study groups, there needs to be documentation for all of them. How can one assess the documentation? Checklists are useful, and the ones that seem to be the most important is to ensure that participation is voluntary. People can withdraw, how it's done, who to contact, up to what time point, inducements and coercion, taking, storage and destruction of tissue samples and recordings. For data and samples, these may be stored. Where are they stored and for how long? And for data sharing, and with whom and how will this be policed? Privacy. Research is published. If there are quotations or images, this needs to be addressed. There needs to be an independent source of information which participants can access should they have any queries about the study. And then there are factors specific to the project, such as disclosure. So this could be a risk of self-harm or harm to others. Audit of records by regulatory authorities and sponsors. And I would like to close with sources of further information. So there's the Health Research Authority, Council, an editorial about 19 case reports and consent for publication, and the documentation that the University of Warwick produced for the paramedic 2 trial for adrenaline and cardiac arrest. Thank you very much.
Margaret, thank you very much. That was fascinating. Okay, we'll now move on to the questions and discussion. We've had a number of questions coming. Can I just remind you, can you make sure you put any questions in the Q&A stream, not in the chat stream, please? The first question, I think is very straightforward to answer. It was asking where the publication guidance that consent is required for all human studies came from. I believe that was from the Declaration of Helsinki. Was that correct, Margaret?
Absolutely. And then if it's reiterated in the guide for authors for all medical journals.
Okay, that's right, thank you. Okay, Bern Rebello asks, you say that misconduct investigations can be conducted decades later. How long would you advise the sponsor of a study to keep this documentation? Is there a generalized number of years?
We don't know at the moment, at least 10, but now are emerging misconduct investigations dating back to studies undertaken in the 70s, as is occurring at King's College London with Isink, who was a well-known psychologist, and he is now deceased. So now one has to be thinking perhaps 50 years.
Thank you, that's good. Okay, Muir had a question about recording consent where participation in research can be deadly if your records are seized. Now, I think this is an application, this question applies to other disciplines of research as well, but I'd be curious for your views on how to record consent safely if research participants could be placed at risk if their participation in the research became known.
Well, there's no hard and fast rule. I think we don't know. We have to play everything on a case-by-case basis.
Thank you. I should say that if you run into that dilemma, do consider approaching your institution's research integrity officer or your research ethics committee for advice. One of the wonderful things about research is that any problem we encounter, someone else has probably encountered it before, and there will be sources of help available to you. Okay, we had a couple more questions. Let's just have a look. We had a question from Khaldoon who was asking, if you are dealing with people who have a mental illness and therefore a vulnerable group, how do you go about seeking their permission to, in general terms, to participate in a research project given requirements of mental capacity in legislation?
It will depend on which country you're doing the research. In the UK, there is the Mental Capacity Act, and there are specific research ethics committees which deal with those types of issues. So the aim is to get consent not only from the person involved, but also their legal representative, and to see what happens, because capacity may change over time. So one has to be flexible.
Thank you, that's really helpful. Okay, we have, right. Richard asked some very interesting questions. He'd like to hear more about how to make it's a demonstrating document that consent is truly informed, that consent has not merely been given, but given on an informed basis.
There is no absolute way of doing it, but it's best that a consent form has sections and that people will consent to individual sections before providing overall consent. So the first clause would be, I have read the information sheet and I am happy to participate in this research project. The second one is that my participation is voluntary. The third one is that I know that I can withdraw up to what time point, and so on, and just detail all the clauses until you get an overall consent. And the research ethics framework, which is on the UK RIO website, has got a type of checklist which people can go through to put in a consent form.
Thank you, that's really helpful. We've had two similar questions, one from Fiona, or another from an anonymous attendee. If you are undertaking informed consent process remotely via an online platform via Zoom, is there sort of any guidance that you can recommend or principles that are worth following? And that include, you know, for example, is it necessary to have sort of independent witnesses? Can things be recorded? Be grateful for your thoughts about that. I suspect the other speakers will field similar questions later about consent in their disciplines. But as we're working on the lockdown, as so much stuff is done virtually now, what are your thoughts on this very live issue?
Anyway, I'm involved and I'm a participant in an online platform research project, which is the UK COVID symptom study. And the way it operates, which I think works quite well, is that you fill in the clauses on the app on your phone, and then you get a confirmatory email. And this could be done for Zoom consent as well.
That's great, thank you. Razmi asks, can we use data that we have collected from a participant who withdraws?
Yes, you can use data from participants who have withdrawn, as long as it hasn't been anonymized or published. This is, and GDPR Article 17, which is one of my early slides, says that you can use it if it is essential for the purpose of the study. And this also pertains to clinical trials and the European Clinical Trial Directive.
Thank you, that's really helpful. Paul has a question. Do you think it would be a good idea if journals published participant information sheets and consent forms as supplementary material? And are you aware of any journals that might already do that?
I am not aware of any journals who do this. I don't think that journals have the expertise to do it. Because do you mean that the journals provide guidance for participant information sheets or consent forms, or have the blank participant information sheet and the blank consent form. And
I think, sorry, I think just to clarify, I think from the way the question was phrased, my apologies not making this clear, it suggested that if a study is published as supplementary information, the journal could also publish blank participant information sheets and consent forms.
Well, it could be done, but then different countries have different clauses and requirements, and it could cause confusion.
Thank you, that's very helpful. That leads into another question. Would you, the principles of consent that you've discussed, the question is, are these principles relatively universal, or is there a lot of variance for local practices in different countries?
Well, what I've described is universal.
Thank you. Okay. Jacob asks, should you engage with renewing consent for longitudinal studies? What are your thoughts on that?
There are some studies which do that, such as the big nurses' health study in the US, which started in the 70s. The issue is if you try and reconsent people for some studies, they may have decided to no longer participate and not told you, or are deceased, and you don't want to cause unnecessary distress to your participants or their relatives. So it depends on the nature of the study and how it is managed and how people are contacted. Some longitudinal studies will keep in good contact with their participants if they want to reconsent for adding in extra data analysis.
Sorry, just I was muted. Thank you, that was very helpful. Belen asks, if you are dealing with higher university students as potential research participants, are there any special regulations or requirements to be considered when working with such students?
I am not aware of global regulations. Each institution will have its own guidance. But the main issue would be in the possibility of coercion or inducement.
Thank you, Margaret, it's very helpful. I'd also add that in the UK, for example, we tend to assume that students are 18 or older, but you can get, depending on when their birthdays fall in the academic year, you can get students sometimes start university, especially those who need to be gifted, and they are actually under 18. So in that sense, they would still be legally children for purposes of consent. So that's something worth considering as well. Okay, we had Andrew asked if presentations will be available. They certainly will be. And Angelica asked if you could expand a bit about the idea of capturing, also recording consent through audio recordings. Do you have any additional thoughts on that?
I presume this would be done by Zoom or Skype, and then the audio recording could be sent back as an attachment to an email.
Brilliant, thank you. Okay, we've got about 5 more minutes for questions, everyone, before we move on to the next presentation, so please do keep them coming. Just to answer, yes, presentations will be available. Okay. All right, hold on, okay. Right, we've got a question about social science research, and what I suggest, Toby, is we save that for when David is speaking later. We will note your question. A comment from Muir that there's been a degree of blurring of public and private information on the internet and social media, and it's an evolving area of consent when conducting any form of internet-mediated research. And I'm just wondering, what are your thoughts on how internet-mediated research and consent works well? What are good practice issues and potential pitfalls in health and biomedical research using the internet?
The major issue is to differentiate between what is in the public domain and what is in the private domain. And various internet mediated research, there will be a data controller who will govern what you can access and what you can't. If you're doing studies analysing tweets, you need to check that you don't use private tweets or deleted tweets. And if you are looking across various platforms, you need to get consent from the participants.
Thank you. Damien has a question. How does Gillick competence factor into working with participants who are legally children? He's asking this question in relation to your list on your slide.
Well, this is a very difficult point because there could be conflict between the child and the parents or legal guardians. And it is best to get consent from the parent and assent from the child. And also Gillick competence is recognised in the UK, but not specifically in England, but not in the rest of the world. And one has to think about publications. So the best world is to get agreement from both the child and the parent and legal representative.
Thank you, that's really helpful. All right, just one moment, please. Arthur raises an issue, and I think I'll answer this one, about how can participants in a research study responsibly challenge researchers when they're aware of irregularities. Arthur, if the research is one subject to statutory regulation, there's an external regulatory body you can go to. There will also be sources within the institution that governs the research in question that you can contact, and you can always contact us for advice. It's also worth considering whether one option is raising concerns directly with the researchers, but obviously there's a power imbalance there and some people might not feel comfortable doing so. But there are bodies you can talk to, and if it's about a specific incident or you'd like some general advice, please do contact us.
Can I,
sorry, Margaret, please do come in.
Can I add in, this is why it is essential that in a participant information sheet and a consent form there is a named person to contact who is independent from the researcher for further information.